When patients hear about robotic surgery or laparoscopic surgery, the first question is, which one is better? And do I really need a robot for my operation? In this video, let's explore the differences between open, laparoscopic and robotic surgery and understand which approach is best suited for different situations. Hello, I'm Dr. Vivek, a GI Onco-Surgeon at the SSO Cancer Centre. I specialize in cancers of the stomach, colon, rectum, esophagus and other parts of the digestive system. Patients often feel overwhelmed when they hear different surgical terms. My aim today is to explain the strengths and limitations of each technique in simple language and most importantly, how doctors decide what is best for you. For decades, open surgery was the only way to perform abdominal operations. It involves a large incision which allows the surgeon direct access to the organs. The advantages are clear visibility, easy handling of complex anatomy, and the ability to deal with surprises inside the abdomen. The downside is that recovery is usually longer. Patients may experience more pain, bigger scar, and a slower return to normal life. However, in certain complex or emergency situations, open surgery is still the safest choice. It remains a vital part of surgical oncology. Then came laparoscopic or keyhole surgery. This involves a small cut through which a camera and instruments are inserted. The surgeon operates while watching a magnified view on a screen. The big advantage is recovery. Because the cuts are smaller, patient usually has less pain, less blood loss, and shorter hospital stay. For many cancers of the stomach, colon, and small intestine, laparoscopic surgery is now the standard of care. But laparoscopy has limitations. The instruments are straight and rigid, which can make very fine movements difficult. The 2D camera also lacks depth perception. So complex surgeries in tight spaces like rectal cancer deep in the pelvis can be challenging. This is where robotic surgery makes a difference. Unlike the name suggests, the robot does not work on its own. The surgeon is in full control sitting at a console. My hand movements are translated into the robot's tiny instruments inside the patient. The advantages are precision and vision. The robot provides a 3D high-definition view, magnifying structures up to 10 times. The instruments can bend and rotate more freely than the human wrist, allowing delicate suturing and dissection even in narrow spaces. Tremors are eliminated, so movements are steady. For patients, this means safer surgery in complex areas, smaller incisions, less blood loss, and potentially faster recovery. Robotic surgery is especially useful in rectal cancer, esophageal cancer, and some stomach cancers where fine precision really matters. The truth is, there is no single answer. The best approach depends on several factors. The type and location of cancer. A large advanced tumor may be safer to remove through open surgery, while an early colon cancer may be perfectly suited for laparoscopy or robotics. The complexity of the operation. Rectal cancers deep in the pelvis are often better handled with robotic assistance. The patient's health condition. Some patients may not be fit for long laparoscopic or robotic procedures and may benefit from open surgery. And finally, the surgeon's expertise. A skilled surgeon using any of these methods can achieve excellent cancer clearance and outcomes. So robotic, laparoscopic, and open surgery each have their role. Robotics adds precision, laparoscopy offers faster recovery, and open surgery provides a reliability in complex or emergency cases. The most important thing to remember is that the approach should be chosen for you based on your cancer, your body, and your overall health. If you are preparing for GI cancer surgery, have an open discussion with your surgeon about why they recommend a particular method. The right choice is the one that balances safety and effectiveness and your quality of life after the surgery. If you found this video useful, please share it. It may help another patient feel informed before their surgery. And don't forget to like, share, and subscribe for more patient-focused education on GI cancer care.